I work here in the pesticide program at EPA Region 9. I have been responsible for agricultural worker safety as well as pesticide certification for many years. So I'm going to be talking about those two things this morning. So, but before that, I wanted to just do a quick little refresher on EPA's role and pesticide safety and all that, and it will be very short, but just EPA regulates pesticides. Every single pesticide that is sold in the country, if it makes particular claims, must be registered with EPA, and that's the work primarily of headquarters. And there's an enormous workforce out there doing pesticide registration and the labeling, and that results in labeling and all of the pesticide safety requirements that are necessary to protect anyone using a pesticide, whether it's a worker or a residential use or URI, using Clorox. And then we also
in a kitchen for a couple of weeks. That homeowner is going to be pretty upset because every day when they get up, they're likely to find mouse droppings throughout the kitchen. Okay, and so we're going to talk about that and, the amount of contamination and what that means when we need to clean it up. So there are...
Hello? Misha or somebody? I'm not sure.
Not sure what happened, Katie, but I think you can go ahead. I just pressed mute all for everyone else. So.
Oh, that's weird. Okay. So anyway, so there's a big regulatory system in place to protect workers and everybody else. Today, I am primarily going to talk about the challenges in protecting workers. So occupational pesticide safety. So as part of their job. And then Matt is going to talk more about some of the enforcement work he has done, the agency has done. That's broader than just occupational, and in fact focuses much more so on sort of consumer safety. So that's kind of the big picture. Oops, how do I move mine? Click, right? Okay, so first of all, when I talk about occupational safety, there's a lot of occupations that require pesticide application and pesticide applicators. So when I talk about occupational, it's agricultural uses, of course, which are, a lot of people think of pesticide use primarily as that, but of course there are all these other settings where pesticide use is critical, in hospitals, of course, but always other institutions. It's very common, and pesticide application is a full-time job for many people. For other people, it is, an incidental part of their work. But there are a lot of, there's a lot of exposure potential in many different occupational settings. And so what EPA has done for that, there are sort of three areas that I'm going to talk about how the agency protects workers. And the first thing is through the labels, and that's all done through the registration at headquarters. And the label is where the agency lays out all of the safety measures, not to mention everything else. For example, you pick up a pesticide and it'll say, you must wear chemical resistant gloves or this or that. And if you don't do that, then you're putting yourself at risk to exposure right away. Another method EPA uses to ensure safety is certification. And that's essentially through registration, there are two types of pesticides that kind of fall out. There's general use, which anyone can purchase without any credentials or additional training. And then there are restricted use products, and those are products that the agency has determined to have such high risk that applicators really need specialized training essentially in order to follow those label directions, which can get pretty complicated. So that, and then the third piece of the puzzle, I suppose, is the worker protection standard. And that is a rule that requires employers to provide some basic pesticide safety training, as well as other protections, but for the agricultural workers. So often people don't think, oh, well, they're a field worker, they're out in the field, they're not engaged with pesticides. But in fact, there's pesticide residue potential in their work. So the training provides awareness, as well as you know, fundamental things about the need to wash their hands and such really basic pesticide safety, how to get residue off and such. So those are kind of the three realms. Oops. So doing all those things is a bit challenging before the coronavirus, right? There were, you know, challenges with providing training to workers who don't speak English. There were, you know, the ag crews can be huge. They can be 200 employees. So there are a lot of, oops, sorry. Oh no. How do I get back? Can someone help me get back?
You should be able to go on your PowerPoint directly and go move back or forward.
I would think so, but I'm not able to. It's not moving. Oh, no, that moved the wrong way. Okay, so, you know, we had this, darn it all. There was this established system. There are these mechanisms in place to keep people safe. All of a sudden, coronavirus comes in and it sets up a whole new stage. And the CDC came out with these guidances for everybody, right? Stay at home, stay isolated. When you're around people, stay 6 feet away, wash and disinfect your hands and surfaces after a contact, wear a mask. And those special N95 masks should all be sent over to the healthcare side of things, because those folks are right on the front lines. They need maximum protection. So those were the basic guidelines, right? Well, they also established critical infrastructure workers. So for those of us, many of us are doing the stay home, work from home option. But there are a lot of workers out there who can't do that because, for like farmers, like people on farms, they have to get the food supply, keep the food supply going, right? So those are essential. Pest control companies have become essential workers. They're the ones out there working with hospitals and schools and doing disinfection for COVID-19 in particular. So with the established protections and then COVID, there's this whole set of new challenges, shall we say. And the first one, everybody's heard about it, was this shortage of N95 masks, filtering face piece respirators. And the reason that's a challenge in the agricultural setting as well as the non-agricultural setting, where many pesticide products will require a filtering face piece respirator. And the most common one is the N95. So if an applicator or a company is intending to use a pesticide and they read the label and one of the protections required is a filtering face piece respirator, and it's possible that they won't be able to find one. So that's the first challenge that I'm going to discuss. And then there's also certification. How do you get people in to do a test in person, which has been the established norm? People come into a room, they take the test, go home, get their results. So there's a challenge there. You can't bring people into a room anymore. So the testing was stalled. Also, continuing education is part of the system to make sure that the applicators maintain their knowledge. But those courses are often in person and have also been canceled. There are online options, but given the number of applicators out there, there has not historically been enough online training to fulfill the needs of all the applicators out there who need additional training. And then another part of the struggle was agricultural workers must be provided some really fundamental pesticide safety training before they start their jobs. But again, how do you do that well within the CDC guidelines? So those have been, really hot issues from our program, from the worker safety side. Whoops. And I want to just talk about EPA's response to these various challenges. 1 second. So as I said, the N95 is the most common respiratory protection required by pesticide labels. It's also necessary in healthcare. So in order to sort of give some guidance on this, EPA put out a paper in June, and this was still fairly early in the whole process that we're in. And the message of that memo was, first of all, you really have to maintain compliance with FIFRA. That means if the label says you need to wear an N95 mask or a filtering face piece respirator, just not wearing it is not an option. There are other options that work that an employer can do. For example, like use a more protective mask, for example, is one of the alternatives. Or try pesticides, another product for the same use that doesn't require that filtering face piece respirator. So something that's, a little milder, perhaps something you haven't used before, but it's would allow you to address the problem while staying in compliance with FIFRA, including the pesticide PPE requirements. Another option that we present is, hire a commercial applicator. They have the PPE for the most part. They have what they need. And then, of course, just don't do the application. I know these aren't, so the alternatives to maintain compliance are, there are alternatives. They're not great. They won't always satisfy the needs of the situation. So the second sort of set of recommendations or guidance can only come into play after employers have tried a number of other things that I just mentioned. So if they can make a case that, it's an emergency, we have to use this product, XYZ, we have to use the N95, there are alternatives. So for example, they can use, the agency has established an extended use or a reuse system for N95 respirators. So in the picture here, the picture on the left is an N95 filtering face piece respirator. The one on the right is a surgical mask. The one on the right is the one that many of us are wearing. The one on the left is the one healthcare providers need, as well as some pesticide application. It's filtering out the particulate matter. It filters out 95% of the contaminants. So that's what I'm talking about. And so the alternatives are things like use one of those that has been certified in another country, for example. NIOSH, many of them are quite similar. Many of them are approved by NIOSH already. They perform similarly. They're just slightly, they might have different markings, different indicators on the front of the mask, but that will be allowable. You could also use them beyond sort of extending the use of the respirator. So generally the N95s are considered disposable, where you use it once and then get rid of it. But there are guidelines for how to safely extend the use. There are also some guidelines on how to use the N95 beyond its sort of recommended service life. So this can be a little complicated. My goal here is really just to sort of plant the seed that there are some alternatives, there are some things to pay attention to. So there are papers. I'm happy to send links to any of them that go into all the details of EPA's guidance on what to do if you find yourself in this situation. So that's the first one. And then the other challenge, of course, is how do you train workers when you can't have more than 10 people in a room or 12 people or whatever? So again, EPA came out with this guidance, and I have to say there's not we're not able to just say, you don't need to train your workers. It's okay, we understand. And so we tried to put together something that would give a little additional help. So, and one of the big questions coming out of this was, well, if we can't do in-person training, can we do remote training? Remote training, meaning online, people in different locations, or perhaps a number of people in one room. But in any case, it doesn't involve face-to-face. And that is allowable. The bottom line is that's allowable. The regulations were written in such a way that we knew at some point in time this would probably come up. We didn't expect it to come up quite this quickly this year or in relation to a pandemic. But nevertheless, this particular guidance document describes sort of as a refresher, essentially, it's a summary of the training requirements and how they can be fulfilled. So for example, the basic, in person, you can continue to do it. You can do it outside, you can do it this way, etc. A lot of training is already done outside. So that doesn't entirely address the concerns. Remote WPS training is allowable. There aren't any additional accommodations, so to speak. So the WPS training requirements still have to be fulfilled. Regardless of who conducts that webinar, the employer is still responsible for making sure that all of their employees get that training. And so another requirement, for example, is that there be somebody available to answer questions at all times. So if the remote training can fulfill all of the standard regulatory requirements, then there's no problem with remote training. Again, it's not simple, but there's a lot of it going on already. Okay, and then the final sort of guidance document, guidance paper was dealing with the issue of certification. And again, the same challenges, right? Certified applicators are those applicators who deal with the most highly toxic pesticides. They need some specialized training, and they must take an exam to prove that they're competent. Well, again, the exams, taking exams has been challenging, administering exams as well, and just providing training for continuing education for the applicators. How do you do that in this remote world? And so EPA had a little more flexibility here in that, given the reality that it was becoming very difficult to renew one's certification because it requires taking courses and taking exams and such. Basically, EPA gave the state agencies the authority to extend the duration of their certifications. So for example, if a state under the federal regulations, certifications, the maximum period is 5 years. Many states, particularly in Region 9, have shorter certification periods, 1 year, 2 years, 3 years, I believe. So, for example, you know, the state of Nevada is having huge challenges, can't get people in, etc. Then they are allowed to extend their period up, extend the certifications. So if your certification expires in December 30th, 2020, and the state establishes a policy that they will extend the date of yours up to a total of 5 years, then that's allowable. It's always allowable, but it does require some administrative bureaucracy. And so basically what EPA has done here is just said, forget the notice, forget the review. If you want to do this, do it. So that was something we haven't done before, kind of novel approach. It is limited. You know, December 31st, 2020, after that date, those programs will have to either give the proper notice, change their rules, change their regs, etc. But between now and then, this system is allowable. And this is particularly relevant in Indian country because anybody who's applying pesticides in Indian country, you know, on tribal land, has to have a federal certificate. So that's issued by EPA Region 9, but it really is based on the state program. So essentially, if applicators in Indian country might be carrying a card that has an expiration date that has passed, it's possible that you could see that out in the field. So far, I'm not aware of any of the states in Region 9 extending their deadlines, but it is still a possibility. So that's something to be attuned to. And you can always, online, there's a list of applicators who are certified federally, or if you have a concern about somebody, you can always call our office and I maintain that list. So that is something to be aware of. And really, I just wanted to go through those three sort of accommodations, so to speak, that EPA has established at this point in time. I find it kind of interesting because, you know, when you think about, when you think about pesticide safety and pesticides and coronavirus, there's a lot of similarities in a way, right? In that they're multiple routes of exposure, inhalation, you can touch things, dermal exposure. They also have a great range of potential health effects. You know, anything on the pesticide side from mild headache or dermatitis all the way to fatality. And it's similar with coronavirus, right? That, you know, people get radically different degrees of sickness and ailment. So I just think that's, you know, it all comes back to the, what's it called? Somebody on the line, the sort of dose, the risk and hazard assessment, where it really depends on the hazard, that is, depends on how much of the contaminant you're exposed to, and the hazard of that. So it's similar concepts. You want to, you know, minimize the dose, the hazard kind of, you can minimize the dose and protect yourself and reduce your overall hazard, or your overall risk to both coronavirus and pesticide safety, pesticide exposure, but we can't trade one for the other because they can both be quite debilitating. And we have a responsibility to protect workers from the pesticide exposure. And there's this larger social and agency responsibility to maintain this pandemic. So I guess the big message is you really have to remember that pesticide safety, pesticide, mitigations can't be traded off in favor of COVID safety. We really have to figure out how to balance both of them. So are there any questions at this point?
Hey, Katie, no questions in the chat box, but if anyone has a question, feel free to unmute yourself or type it in and we can ask it now. All right, seems like no one has any questions, so feel free to move forward.
Well, I should probably mute myself because my cat is screaming. So I think it's time for you, Matt, and I suspect you'll get a lot more questions than me.
If so, that's only because you were very thorough in your presentation, Katie. Thanks for putting that together. We're very lucky to have Katie in the region. She knows. The common saying is somebody knows more, or somebody's forgotten more than I know about FIFRA. But Katie knows so much; she's probably forgotten more while she was doing the presentation than I know about FIFRA. There's a question. I think probably for Katie. For pesticide applicator training through EPA? Question mark. And do you know if the November classes will still be held? I guess that's all one question.
I'm sorry, what's the question?
Do you know if the November classes for pesticide applicator training through EPA will still be held?
I believe that question must relate to the private applicator training for, and private applicators work in the agricultural realm. Yes, that training will still happen. It's a good training. A lot of people have taken that training expecting to get qualified. Yes, the training is still on. When it comes around, make sure it's the appropriate training for you and what you want to do. Bottom line.
Excellent. Okay, I'm going to try to share my screen. Let's see. Oh, okay, hold disable, put it on screen share. Let's see. Request remote control.
Stop.
No. Let's see. Okay. Let's see. Okay, I'm trying to figure out how to share my screen.
You see the green button at the bottom?
It says the host disabled participant screen sharing, so it must be a participant.
So I believe Desiree, the host, can give you access.
Okay. So while I'm getting access, I guess I'll introduce myself. I'm Matt Salazar. I manage the Toxics Enforcement Team at EPA Region 9. I've done Clean Air Act enforcement for about 12 years. I was an inspector and then a manager for the group for about half of the time each. And then I was in Superfund being a project manager for about 4 years in between there. And I moved to manage the Fifra group about a year ago. So that's me. Let me see if I could share screen yet. It's still disabled from sharing screen. So let me.
I'm going to interrupt you real quick, Matt. You should have the screen share capability on the bottom of your screen now.
Oh, perfect. Okay, excellent. Thanks for doing that. Okay, so hopefully you guys can see that now. Sorry for the disruption. Let's see. Okay, so mostly what I'm going to talk about is the illegal disinfectant work that my team's been doing basically since the pandemic started in March. I'm going to go over quickly the difference between FDA and EPA regulations, and I'll give you some examples. And then I'll also just briefly mention that we are working on worker protection oversight. We believe strongly that the farm workers are essential workers, and fairly often we see reports of farm workers being harmed or injured by pesticide exposure, and we're overseeing a decent number of investigations by the agricultural commissioners, the states of the tribes, to make sure that the responsible parties, if appropriate, are penalized to the greatest extent that they can. We certainly understand that in this time of need, we need as many of our farm workers as possible doing their jobs, and then we're trying to protect them. As I don't need to share, oftentimes they're the most vulnerable populations that we work with, and we're doing what we can in the especially considering that the penalties structure makes it difficult to get fairly high penalties. We're up to in worker protection. Let's see. Perfect. Okay. So illegal disinfectants. Let's see if you can see that. People will be shocked to know there's been a proliferation of illegal disinfectants since the pandemic started. One of the things I did when I was in the air group was I worked a lot with Customs and Border Protection on working on imports at the Port of Long Beach and the Port of Oakland and the Port of Honolulu, making sure that engines and vehicles that enter the U.S. Complied with Clean Air Act rules. And that was one of my goals when I moved over to manage the Fifra group, was to make sure that the pesticides that came in also obeyed federal Fifra rules. So we made preparations to start up, increasing our work there. And then amazingly enough, the pandemic happened, and the number of illegal products flowing through the ports just ballooned. And so I guess a quick example of a product that looks more legal. Some disinfectant wipes that I bought prior to the pandemic because you can't get them now. You can see very smallly, there's the EPA registration number right about here. It has directions for use, which states that the surface that you're cleaning needs to be wet for about 10 minutes to disinfect. And those are small examples of what a legal product says. FDA regulates, as you guys probably know, regulates stuff that goes on human bodies like skin. So hand sanitizers are regulated by FDA. Surface sanitizers, surface disinfectants are regulated by EPA, which is something that a lot of people are either unaware of or are finding out now. And we do that to make sure that the products that people buy are safe, that they're effective, they do what they're supposed to do. To register a product, you have to send in efficacy data to the agency, to headquarters, and the directions for use are clear and understandable, right? I mean, the fact that the surface has to be wet for 10 minutes to disinfect is fairly important, especially in when you're trying to keep your family safe. And so many people have been bringing in illegal products. They're either unaware or are trying to make a lot of money off of products which may or may not do what they say they do. And so we'll go through examples here. Part of it is misleading public health claims. A lot of the products we've encountered, say that they're effective against the coronavirus, but they don't have any studies showing that. Other times they say they're effective against COVID-19, which is interesting because that's the symptoms of the virus, and it's fairly difficult for a surface disinfectant to help your symptoms. We're not sure what's in them. They're not evaluated by EPA for efficacy or safety. They could potentially be harmful if misused, or if there's stuff in there that you don't know that's in there, right? I mean, FDA has done very public recalls with companies for having the wrong type of alcohol, having wood alcohol and hand sanitizers, which is very dangerous. And we've actually denied products from the same companies that FDA has done recalls for. We don't do as much testing as they do, just based on our budget and staff size, but we do check to make sure products are registered. We're working on sort of all realms of the purchasing cycle. We're working with customs to stop the sort of avalanche of imports coming through, mostly Long Beach, but also Honolulu and San Francisco. We've also done a number of advisory letters to large e-commerce sites, basically letting them know that some of their offerings, if not many of their offerings, are illegal and they face fines. We've sent letters to Craigslist and eBay, Alibaba, the agency, different regions sent them to Amazon. But we've sent out, I think 24 or 25 letters to e-commerce sites, large and small, telling them to knock it off in terms of selling, making a profit off of illegal products during a pandemic. We've also, as I mentioned, worked with Customs and Border Protection. We've, since the beginning of March, we've denied over 195 shipments of illegal goods containing over 6.9 million units, which is a sort of staggering amount. When I was working with the AIR program, we were very impressed with ourselves for stopping 40 shipments in 1 year and stopping a combined something like 15 or 16,000 illegal engines. And in the last 6 months, the numbers for illegal disinfectants have just dwarfed that. And my team, along with CBP, has just been basically swamped, busy doing multiple inspections a day. We've also been doing stop sales too. A number of both domestic and foreign companies have been selling products with directions for use that are inconsistent with labeling or don't do what they say they're going to do. And so we'll go through some examples. So here's an example of a product we stopped at the port. You can see the directions for use on this. Apparently you spray it. It's going to give you 30 days of a continuous antimicrobial coating. It kills viruses. This looks very much like the coronavirus, shockingly. It also kills bacteria. It says it sterilizes viruses and bacteria. It says it's safe. And it's pleasant too, which is nice. It's nice that the illegal products are pleasant. And so, you can tell there's no EPA registration number. As far as we could tell, their claim of 30 days of continuous antimicrobial coating has not been tested, and we denied this product. Here's another example of a surface disinfectant. You can see it says it's effective against 650 types of bacteria and viruses, including coronavirus. Certainly we've come across, a decent number of companies which actually have tested against coronavirus. Testing against coronavirus in the US, it seems to be a fairly difficult process. You have to make sure it's tested in a level 3 biosafe facility, which makes sense, right? Nobody would want that getting out of a lab. It's fairly costly. We've heard numbers in the 5 figures, if not 6 figures. So it depends. You can see this product also uses an EPA logo, which is illegal. Certainly in this context, approved ingredient for COVID-19. This is not something that we would allow on a label, nor does it have sort of really good directions on what you would need to do. So we denied this product. All Clean is another product that we denied. Claims it's a disinfectant. It claims it sterilizes at 99.9%. Neither of these are approved claims. It's a self-disinfectant sanitizer. You guys probably know this, but disinfectant and sanitizer, as well as sterilize, has different requirements. And any product that has all 3 on the label is going to have issues with us. A lot of the companies also, will show pictograms of surfaces, we've denied products specifically that don't have any of the claims, but just have pictures that sort of show that you could use them on surfaces, but have not been approved by EPA. Okay, here's another set of wipes. You can see this one has a really official looking doctor on the front. Claims an alcohol content of 75%. Part of what we like to say is that we don't actually know if the alcohol content is 75%. One of the companies that we denied entry to, Customs and Border Protection had tested, and it showed that it was at 52%, which is below CDC guidelines. as well as the fact that we don't know what type of alcohol is in there. And again, this mentions coronavirus and cold flu viruses. Here's another product. It has an EPA logo on it. The directions are not in English, which is typically a red flag. Most approved labels have to be in English. Sugal disinfectant spray. You can see it says it's effective against a number of things. It has viruses on the front. Here's a solution from OCCS, which is a company that is based out of in California. We did a stop sale against them. They were using this product, making claims. You could actually tell on the picture that they had a label that may or may not have been approved, but they covered it up with another label, which was certainly unapproved. And we stopped them from selling this as it was had claims that were not allowed. As well as, so what they did with this, interestingly enough, is they diluted it additionally and turned it into window cleaner. So work there. Here's another example of surface disinfectants. This is a John Wayne picture, as people probably know. I'm going to guess that John Wayne wasn't actually paid to endorse this illegal product. And again, it mentions it's effective against viruses, bacteria, and fungi, and it's not allowed. It's not a registered product. This is an interesting set of products. These are some of the first products that we denied. The virus shutout product is interesting, and it claims that if you wear it around your neck, it emits usually for I guess 1 or 2 month period. Let's see, this is 1 or 2 month period to emit an acid cloud. They don't say acid cloud, but that's basically what it is. An acid cloud that will kill any viruses or bacteria that enter your airspace. And it doesn't work. What people have told us is that if it was going to emit enough acid gas to kill the bacteria, it would probably harm, if not kill you. So this just is a total scam of a product. There's quite a few of these different products that basically say the same thing. And we've denied, I think, over 40 shipments of these, large and small. Some of them hidden in other things. Our partners at Customer Board actually did a really good job of finding a bunch of these. See, Air Doctor is a similar type of product. This is a company based out of San Diego. We did a stop sale requiring them to stop selling these products. They're actually found at a Bartell's, which is a drug storage chain out of the Seattle area. And they were basically snookered by this company that again, it shows a picture of a young woman, and they say this is more effective than a mask, which we believe is utterly false, and certainly doesn't help the cause. And I've seen pictures on the website of products like these. Somebody wearing them in a hospital room with a 2 thumbs up, saying, "Thank you for selling me this. I was able to visit a sick person and be protected," which is not a good message to send for a completely. This is basically snake oil. Here's another example of the Air Doctor product. We did a lot of advisory letters to e-commerce companies, as I mentioned before, basically telling them to knock these off. A lot of the companies, really should have done a better job keeping your products off of their shelves or off of their e-commerce sites. Most of the companies have worked with us to try to get these listings taken down. Another Air Card. Oh, this is one of my favorite ones. We've seen a lot of UV products recently. Products are registered differently than actual pesticidal products like the disinfectants. And the message I probably should have told you before is that one of the reasons why EPA regulates disinfectants is because viruses and germs and bacteria are considered pests, and EPA regulates all killing of pests. And it's really important for disinfectants because people can't actually very obviously see the viruses or the bacteria or the germs being killed with your eyes, right? So that's why we require companies to send us data and tests to show that they do what they say they're going to do, and why unregistered products are it may not work, they may not be helpful, and like some of these products, they may actually cause adverse effects on the users, which is not what we're going for. So a lot of these UV products, aren't registered. Some of them, we're fairly confident are actually not the right spectrum even to kill viruses or bacteria. We think a lot of these products, not necessarily this one specifically, because we don't have it tested, but we think a lot of the products, are basically using UV lights that are meant for, like in a dance club, making your clothes look more white, or checking dollar bills or whatever, to see UV stuff. And it's not going to be; those things are not going to be effective, unsurprisingly, against viruses and bacteria. And so this specific product mentions that it can use UV light to kill harmful substances through obstacles, like a cabinet, which is interesting, and I don't think possible. I'm fairly certain that UV light, if it's at the right spectrum, requires a certain contact time and actually exposure to the light itself. If the light is blocked over on this side, I'm pretty sure it's not killing anything. So we denied this product. Here's another one. Of course, this is a baby bottle sterilizer. It's not registered. It has an EPA logo on it, or FDA logo, which may or may not be registered by FDA. But it's, certainly we have no data to show it works, and which is fairly frightening for a product made ostensibly to cleanse or sterilize a baby bottle. And here's another UV sanitizing station. It claims it kills 99.9% of germs. We have no data on that. Here's another example of wipes, and again, it shows stay safe on the go, which we believe is disinfectant claims. And another example of a product which may or may not be legal in another country that says it kills a bunch of germs. There's lots and lots and lots of these. Okay. I think that's all I have on that. So again, we're working really hard to keep unregistered and potentially dangerous products excuse me, out of the American consumer. Oh, Clinty said, did I get it wrong? I get confused between my Western people. I think that's all I got. Anybody have any questions for me or Katie?
No questions in the chat box, but if people want to unmute themselves, feel free to ask or type more questions in the chat box. We have about 10 minutes left of the session.
Matt, I have a question. Can you hear me?
Yeah.
I'm curious to know, I know all about looking for the EPA registration number on conventional standard pesticides, as well as, the hand wipes, or excuse me, the surface wipes. How can you tell if a hand wipe is FDA approved or legal?
Yeah, that's a good question. We've been more, of course, focused on the other thing. My general understanding is that it depends on the type of alcohol. I think, what is it for? I think isopropyl. Well, let me do some research before I tell a bunch of people things that aren't actually true. Part of what we look at is for EPA purposes is if the hand sanitizer also makes surface claims, which we've seen a bunch of, and a lot of the companies sort of aren't aware that if the company says safe for your hands and for your phone or for your kitchen counter or whatever, then it's supposed to be registered by both. So I actually think I have the page up. So let me look real quick on the question about alcohol content, and I'll get right back to it.
I did not put you on the spot. I have just found it personally. I've gone into stores and I look and I try to look for that EPA number, and I realize I don't have any idea how to tell for the hand wipes. So maybe that could be a follow-up for all of us.
Yeah, I think that's a good question. And we do, of course, partner with FDA when stuff comes in that we think is fraudulently making FDA claims. We send it to our partners at FDA, and they're also very busy making sure that stuff that goes on the body is properly registered and legal, that kind of stuff. And as people won't be surprised to know, there's lots of weird stuff happening out there in terms of disinfectant tunnels being made where people step through them and stuff's being sprayed at them that oftentimes is not meant for that. It potentially is meant for hard surfaces, not necessarily soft surface like skin and clothes.
Matt, were you looking something up, or are you waiting for more questions?
Oh, waiting for more questions. Yeah.
Any more questions with our last remaining minutes? Going once, twice. All right. Well, thank you for that presentation. It was really interesting to hear, especially in the time we're in and all the different products out there. So appreciate it. This session was recorded, so people can refer back to it later. Thank you.
Thank you
Thanks for
all.
everybody's time.